All right. Hi, my name is Crystaline Prothro. I'm the family nurse practitioner student at GSW, and today I'm going to be conducting a head-to-toe assessment on this patient here. Before coming in, I obtained your height and weight, your vital signs, which were all perfect, normal, within normal limits, and I did a visual acuity test with your glasses on to test for cranial nerve number 2. Okay? To test your orientation, I've already viewed your chart, so I'm going to compare what's in your chart to what you tell me. And what's your date of birth?
7/29/89.
And your full name?
Joseph Isaka.
And where are we right now?
Southern Regional ER.
And what year are we in?
2018.
And the president?
Trump.
Okay. So the patient is alert and oriented ×4 to person, place, time, and situation. So now I'll get started. I'm first going to take a look at your hair. And your hair seems to be evenly distributed with no bald spots or anything. I don't feel any lesions or contusions or at all. Do you have any pain at all when I do that?
No.
Okay. I also am going to feel his skin is soft, warm, and dry throughout. Any lesions at all?
No.
I don't notice any skin discolorations or bumps or rashes noted. If I can see your fingernails, they're flat and pink in color appropriately. And as I push them down, I get immediate color return on the nail bed. So that's great. I'm now going to move on to your face. I'm going to put gloves on. Okay. All right. If you could remove your glasses for me. Okay. I see that your face is symmetric and no lesions or bulging. Did I see any pain when I'm touching here?
No.
Okay. So the head size and shape and symmetry are normal and appropriate. There's no tenderness at all. While I'm here, I'm going to assess the TMJ. Okay, open your mouth and close. Okay. And there's any pain right there when I do that?
No.
No. And I don't feel any displacement either. While I'm here, I'm going to feel the temporal lobes, and they're both in place. And wiggle your forehead. Close your eyes real tight. Smile real big. Okay, and so now I've tested for cranial nerves 3, 4, and 6, and they're all appropriate. Now I'm sorry, cranial nerves 5 and 7. I'm sorry, cranial nerves 5 and 7. Now I'm going to move on to your eyes, and his eyes are symmetric and no edema or swelling around it. As I feel around, is there any pain there?
No.
Okay, if you look straight ahead, the sclera is white, the pupils and iris are dark brown, so they're appropriate there. As I stand here, I'm going to do a couple of tests from you, okay? First, I'm going to test the 6 cardinal positions of gaze, okay? So keep your head straight and just follow my finger with your eyes. Okay, and now I'm going to have you cover your left eye. Look straight ahead. And I see no nystagmus noted when he does that. And now with that same eye covered, let me know when you see my finger come into view.
Yeah.
Okay, keep your eyes straight, cover the right eye. Again, I see no nystagmus. If you could tell me when you see my hand come into view. Okay, and so there, with the confrontation test, everything is normal and the patient has good visual field, which tests for cranial nerve number 2. Now I'm going to use the light, and I'm going to test your reactivity. Take a look straight at me. All right. Okay, pupils are equal, round, and reactive to this light. I'm now going to shine the light right in the middle of your eye, and I'm going to test for the Hirschberg test and make sure that I can see a light evenly. Look straight ahead in both eyes, and I do. And now I'm going to test the red light reflex, okay? Look straight ahead. Going to get real close. And I do see the red light in both eyes. So everything seems to be intact with the patient's eyes. Now I'm going to move on to the ears. As I feel and palpate, is there any pain?
No.
The ears are symmetric, even in color, and appropriately matched to the face and the rest of the skin. Okay, one moment. Okay, and so now I'm going to use the light And I'm going to view the internal ear. And on this side. Okay. And the ear canal is clean and open, and the eardrum is flat and gray in color as it should be. While I'm here, I'm going to conduct a whisper test that's going to test for cranial nerve 8. So I'm going to whisper a number into Joseph's ear and have him repeat it back.
89.
Okay.
89.
All right, very good. And those were the numbers that I gave to Joseph. So now I'm going to move down to his nose. The nose is symmetric in shape. Any pain when I'm touching?
No.
Septum is even and symmetric and midline. Now I'm going to get the light and take a look internally. Okay, and I don't see any turbinae that are inappropriate or displaced. They're not swollen or anything like that, so everything's there. I'm going to hold on one side and have you breathe in, and the other side. Okay, patient's able to breathe in through the nostrils appropriately. Now I'm going to open up an item and have Joseph smell it and tell me what it is he's smelling, okay?
Where you want him?
Close your eyes. And what are you smelling?
Alcohol.
Okay, alcohol swab is correct. Sorry about that. So Joseph did really well, and I was able to observe cranial nerve number 1 with the alcohol smell. Are you okay? Okay. Now I'm going to move on to the mouth. The lips are evenly distributed and symmetric. They're pink in color, no cracked lips, no dryness. Everything seems appropriate. If you could put on your lip for me. Okay, the mucous membrane is pink and intact and moist. If you could smile for me real big, stick out your tongue, left to right, up and down. All right, and so this just tests for cranial nerves 9 and 12, doing those activities there. I'm now going to look at the uvula and check for symmetry. Say ah.
Ah.
Okay, patient's uvula is midline, no deviation at all noted. Now I'm going to look at the neck, and as I palpate, let me know if you feel any pain. Any pain? I don't feel any masses. I'm feeling for the lymph nodes here, under the chin, down the neck, and across the clavicle. No swelling noted in, or edema or nodules noted in the lymph nodes. I'm now going to feel here, and the trachea is midline, so that's great. I'm going to hold my hand here. I'm going to have you swallow to check for your thyroid placement and size. So swallow for me. Okay, very good. And that just tests for cranial nerve number 10, okay? Now that we're here on the neck, I'm gonna have you turn your head to the left, all right? And then try to push against my hand, okay? And look to the right and push against my hand. Great, and that's testing for cranial nerve number 11, and it is intact. The patient has good muscle tone in his neck and able to do so. Now, as I look at Joseph, I see that his respiratory rate is even and unlabored. Chest expansion is normal and symmetric. So I'm going to move on to the lung sounds, okay? Okay, in and out. Again. Okay. And posteriorly, in and out. In and out. Again. Again. One more time. Okay. And so with auscultating the lung sounds, all 5 lobes are clear upon auscultation, okay? So now, as I move from front and back, I see the anterior and posterior diameter are appropriate 2 to 1, as they should be, okay? Now, while I'm back here, I'm gonna feel your kidneys, any pain here. I'm gonna check for CVA tenderness. When I tap on my hand, let me know if you feel any pain. Any pain?
No.
Any pain?
No.
Okay. And now when I come back to the front, I'm gonna check the heart. And I'm going to feel in the 4th or 5th intercostal space. And I'm going to put my hand here and just check for the point of maximal impulse. And I do feel it. And now I'm going to listen to the heart sounds. Okay, and I hear love dub appropriate in all of the areas of the heart. Appropriate placement of the heart, no enlargement noted. Okay, now I'm going to move on to the abdomen. I'm going to have Joseph lay back. I'm going to recline. And if you could pull up your shirt for me. So you can see. All right, so as Joseph lays down, there's appropriate movement of the abdomen. I do see vibration, which is normal. The color and everything is symmetrical and normal for a race and appropriate, okay? I'm now going to listen to the quadrants for vowel sounds. And while I'm here, I'm also going to listen for the aortic artery, make sure there's no bruits, and listen for the pulses there. And the femoral arteries. Okay, and they are appropriate. All right, and so now I'm going to percuss the abdomen. Listen for tympanic noises. And they are appropriate, so there's no fluid buildup in the abdomen, which is good. Now I'm going to palpate the abdomen. Any pain when I do this, Joseph? Okay. I'm going to put my hand here, and I'm going to have the patient take a deep breath in. Okay. And I do feel the edge of the liver, which is great. And another deep breath in here. And I do not feel the edge of the spleen, so there's no enlargement there. While I'm still here palpating, I'm going to feel the femoral artery. Okay, and it is present. Okay, so that's good. If you could sit up for me. Very good. All right, so now if you come to the edge there. I'm now going to move on, and I'm going to test for the musculoskeletal system here. I'm going to have you raise your right arm and down, left arm and down, right leg and down, left leg and down. Okay. Now hold your arm straight headed in front of you. All right. And don't let me push down. Okay. And don't let me pull up with the legs. Hold them out. Don't let me push down. Don't let me pull up. Very good. And so there's good muscle tone to all of the extremities and good range of motion there as well. I'm now going to change my glove because I broke it. I'm now going to have you stand up. I'm going to test a few things. I'm going to have you first lean down and touch your toes. And I'm testing for the spinal curvature. And just with visualizing it, I don't see any abnormality or deviation there. And as I feel, it's midline and in place. Okay, you can stand up, take your time. All right, now I'm going to have you walk forward for me. All right, and gait is steady. Turn around and you can walk back. Very good. Steady gait with no issues. Now walk towards the door, heel to toe. Very good, and come back. Very good. And while you're there, if you could turn around for me, keep your feet flat and your hands right by your side and close your eyes. I'm testing the Rumberg's test, and I don't see any swaying with your eyes closed. Okay, you can open your eyes. Very good. Now I'm going to have you take a seat. Okay, we're almost done. If you could put your arms on your hand, I don't know if I had you do it yet. Now we're going to test for rapid alternating movements. Turn your hand over and back the other way and back and forth as fast as you can. Very good, very good. All right, that's good. Now, while we're here sitting down, I'm going to check your peripheral, your peripheral nerves. Okay. I'm going to use a piece of cotton. Just let me know when you feel me touching you. Okay. Close your eyes. All right.
Feel it. Feel it. Feel it. Feel it.
Well,
Okay. Keep your eyes closed.
Feel it. Feel it. Feel it.
I'll go do that.
Feel it. Feel it. Feel it.
Okay. And do these touches feel even on both sides?
Yes,
And this side?
yes, ma'am.
Very good. Okay. So then we see that your peripheral nerves are intact. I'm trying to think if I forgot anything else. Your reflexes. But let me continue. I got your pulses and your temporal pulses, your carotid pulses, and I did your femoral pulses. Now I'm going to check radial pulses. Turn your hand over. The ulnar pulses. Okay. Behind the knee. I'm going to do the dorsopedialis. I'm sorry, the Achilles here, and then the dorsopedialis. Very good. All right, so all pulses are there. Neuro so far has been great, and now I'm just going to do your reflexes.
Boy, share your location, please. Boy, share location.
All right, and so with this, I'm going to tap the tendon here in your radial brachialis. Okay, and I do see movement there on the other side. Very good. And now I'm going to test the brachial. And I do see movement here in the brachial. And let your arm hang for me. Okay. And again, I do see the muscle junk and the triceps. One moment. I do see the brachial reflexes there. And if you can hold your arm. Let it down. Hold your arm this way. And okay, I do see the tricep reflexes as well there. Now if you could move your arm to the side for me, you want to check your knees. Okay. Okay. And this way. Okay, very good. And now I'm going to check the Achilles. And this side. And the Babinski reflex. One moment, please. Okay. All reflexes seem to be, sorry about the interruptions, seem to be intact. Joseph has been good, and everything seems to be appropriate. Any questions or concerns for me?
No, thank you.
All right. And that concludes the assessment head to toe. Thank you very much.